In a move that underscores the gravity of its current situation, Botswana has officially declared a national public health emergency. The decision comes amid a severe shortage of vital medicines and essential medical supplies, a crisis that threatens the well-being of millions across the country. President Duma Boko addressed the nation on Monday in a televised speech, unveiling a significant multi-million-dollar plan aimed at resolving the crippling supply chain issues. In an unprecedented step, military oversight will play a key role in managing the distribution of resources. This is a highly sensitive issue, President Boko explained, emphasizing the financial strain on the nation's already stretched budget. Our coffers are limited, but we must act decisively to address this challenge. So why is Botswana facing such a dire predicament? For starters, the country's economy, historically buoyed by diamond exports, is now grappling with the repercussions of a global downturn in the diamond market. As one of the largest diamond producers worldwide, Botswana has felt the brunt of fluctuating prices and reduced demand. Adding to this economic strain, recent cuts to U.S. aid have exacerbated existing vulnerabilities, contributing to rising unemployment and poverty levels. These factors paint a bleak picture for a nation whose population is just 2.5 million. But here's where it gets controversial. How much responsibility should international partners bear in supporting countries like Botswana during tough times? The U.S., under former President Donald Trump, had previously funded a third of Botswana's HIV response, a lifeline for many citizens. With those funds slashed, the government now faces mounting debts exceeding 1 billion pula, £55.2 million, much of which stems from private hospital admissions for treatments unavailable in public facilities. Dr. Stephen Modiz, Botswana's health minister, elaborated on the scope of the shortages, listing critical items such as cancer medications, HIV treatments, and tuberculosis supplies among those affected. Elective surgeries and non-urgent procedures, including organ transplants, have been temporarily suspended due to these constraints. Yet, amidst the challenges, optimism persists. "I believe we will overcome this soon," Dr. Modiz stated confidently. "It may seem overwhelming, but this problem is not insurmountable." To tackle the immediate crisis, the first wave of military-led distribution trucks departed from Gaborone, the capital city, on Monday evening, destined for remote regions. This logistical effort marks the beginning of what officials hope will be a turning point in restoring healthcare access nationwide. Meanwhile, organizations like UNICEF are urging urgent action to safeguard the health and future of Botswana's children, particularly in areas like Dakar, where malnutrition remains a daily battle. And this is the part most people miss. While the world focuses on larger economies or more politically charged nations, smaller yet strategically important countries like Botswana often fall through the cracks. What does this say about global solidarity when crises emerge in less prominent regions? Should wealthier nations step up their contributions to avoid similar emergencies elsewhere? For context, President Boko, a Harvard-educated lawyer who made history last year by leading his party, the Umbrella for Democratic Change, UDC, to victory after nearly 6 decades of uninterrupted rule by the previous administration, has vowed to diversify Botswana's economy beyond its reliance on diamonds. But achieving this goal won't happen overnight. As Botswana navigates this turbulent period, one question lingers. Can the country rebuild its healthcare system swiftly enough to prevent further suffering? Or will external pressures continue to hinder progress? Share your thoughts in the comments below. Do you think international communities should intervene more actively? Or is self-reliance the only sustainable path forward?